Hi, everyone. Good morning or good afternoon or good evening, depending on where you're joining us from. Welcome. We're so excited to welcome everyone to the APPA Justice Involved Women and Girls Committee first webinar of 2024. Super excited, really grateful to have everyone here to talk with us about essential innovations for justice involved women, and specifically the promise and impact of center-based models. I want to thank my co-presenters who will introduce themselves in a few moments, and a huge thanks to APPA for all of their support, Josh and Kylie and their team for supporting all the elements of this event. What I'll do first is get my screen sharing, and while I do that, I would love to invite my co-presenters to introduce themselves. I'm Alyssa Benedict, co-founder of the Women's Justice Institute and executive director of Core Associates, and co-chair of the Women and Girls Committee. And I will now hand it to Deanne so that she can kick off our presenter introductions.
Hi, everyone. We're really excited and energized for our first webinar. And again, I'm Deanne Benos. I'm also the oldest counterpart, the other co-chair of the APPA Justice Involved Women and Girls Committee. I am also the co-founder and the director of the Women's Justice Institute. And welcome, and we're excited to have this conversation today.
Hey everyone, Colette Payne. Preferred pronouns are she and her. I'm the director here at the Reclamation Center in Chicago, Illinois, and we are glad to be with you all today.
Hi everyone, I'm Liz Cruz, Senior Advisor for the Women's Justice Institute, Health and Wellbeing and Gender Responsive Services, and I am so grateful to be here today.
And then Leticia's team can introduce themselves.
Good morning, everyone. Leticia Longoria Navarro. I use she, her, aya pronouns, and I'm the executive director of the Pathfinder Network, and I'll pass it to Tiffany.
Good morning. Excited to be here with everyone. My name is Tiffany Atkinson. I'm the peer support department manager for the Pathfinder Network.
And good morning, everyone. I am Kim Whitney, she, her pronouns, and I am the district manager for the Oregon Department of Human Services.
Hi, everyone. I'm Lindsay Ozine, and I am a program manager within Jackson County Community Justice in Medford, Oregon.
Awesome. Thank you so much. And Josh, could you confirm that my screen share is okay?
Yes, you look great.
Okay, awesome. So we will dive in and kind of get started. The first thing I would love to do is just share some brief information about the Women and Girls Committee for APPA. We have three main goals, as you can see here on the PowerPoint, that we generated with our incredible, huge team of folks and allies. Transform the narrative about justice-involved women and girls to make up for our false narratives that have really plagued the field for quite some time, generate valuable information for and with the field on strengths and challenges, and also opportunities associated with implementing gender responsive practices in all the different spaces that we're in this work. And then most importantly, to actively engage diverse groups of directly impacted women on solutions. So we're really excited about the work that we do, and this webinar series is an exciting element of that grew out of our discussions as a committee. It allows us to push really important cutting edge information to the field that's not even quite written about yet, hear and learn from the field, and of course, generate a stronger national dialogue on women in justice. So a few housekeeping items. If you're looking at the screen in the PowerPoints, we'll share several today. And in the right-hand corner of the PowerPoint, there's an expansion function. It's a double-sided arrow. So if you click that, it will look a lot larger if you prefer a larger view of the PowerPoints. We're so thrilled. We have over 35 states in attendance today and 5 countries and territories. So there's a number of you here with us. So what we thought we would do for efficiency is save a Q&A for the end. So there'll be an optional 10 or 15 minutes after the webinar 60-minute content is done. And you're welcome to stay on for us to have some dialogue together. And you're welcome to use the chat anytime. So those are some of the housekeeping items I wanted to share. And I thought I'd start with some context that we're all familiar with. You know, we've known for some time that women are becoming entrenched in our systems. Their incarceration has grown exponentially over the past few decades. And as you know, this is a very familiar view for a lot of us. According to PPI, as you can see here, since 2009, women have fared worse than men in over 35 states, and that's climbing, where at least one of the next three things I'm going to say is happening. It's either that the women's population has grown while men's populations have declined. Either their growth is outpacing the growth of men, so there's rising on both ends, but it's rising more for women, or in the states where there's declines, the declines are less dramatic for women. And a lot of this is being linked to gender neutral reform efforts that don't really account for women's unique strengths and needs. We know that they're historically a much smaller population in our criminal justice systems, and so the result historically is treating them as an afterthought. We all know for years a lot of the research we conducted on criminal justice and effective interventions focused on men and often the stereotypical needs of men. And as a result, we implemented policies and practices that really were attuned to women's strengths and needs, and in many cases were harmful. We've talked a lot about that as a committee. We also know that we still have the plague of disproportionality, where women of color are disproportionately represented at all points of the criminal justice system. We know children of color are more likely to have a parent or caretaker behind bars, and that takes a tremendous toll. We know this is crippling and demoralizing for communities of color and households. And we also know that Indigenous women are among the most marginalized group, not only in the US, but in the world. I've done some really incredibly inspiring research with a team on that. So if you have questions about that, please reach out. And so disproportionality has been significant, and just as the numbers of incarcerated women have grown over time, so too have the numbers of women on community supervision. We know the women on probation and parole nationally in the US, it nearly doubled since 1990. So we have over 1 million women on community supervision right now across the nation. And we know that community supervision was meant to be an alternative to incarceration. And what we know for women is that it's become one of the most significant drivers. And outcomes, once again, and very unfortunately for Black, Indigenous, and women of color, as well as those who identify as LGBTQI, are more negative and pretty severe. So when we now look back at where we were and where we've been, the story gets more positive because advocates and providers, feminist scholars, women leaders with lived experience have really provoked a number of incredible amounts of research and advocacy campaigns that have led to new knowledge. So we know the key themes from this research, as noted here, is that women have distinct pathways into and through systems. Most come from neighborhoods that are entrenched in lack of resources, chronic poverty. Alarmingly high numbers of women, as we know, have experienced gender-based violence, serious physical and sexual abuse, often beginning when they're children, with people they love and trust, and persisting into adulthood, which is a very different profile than other gender groups. We know from the research also that women are plagued with chronic physical and behavioral health needs in the wake of these experiences in their communities, and then lack resources and supports to integrate what their experiences have been and address the needs and build on strengths, which is often a glaring absence in our narrative. It's about risk and not strength. And so they're navigating these conditions, often while taking care of dependent children. And the majority of women, as we know, in the criminal justice system are the sole support and caregivers for their children, and often other family members, not just children. So then we know that the challenges that they face before incarceration or community supervision often get worse once they're system involved. So instead of system involvement being a source of support and healing and recovery, it becomes another source of trauma and oppression. So they become more financially unstable, face more barriers to education and employment, related financial strain, housing insecurity, trapped in coercive, violent housing situations, often linked to supervision conditions, more parental stress, risk of ongoing exposure to gender-based violence. And so the conditions that we're realizing through our research and inquiry into the field, the conditions imposed on women on community supervision are often deeply restrictive and create additional barriers and harm. Things like long supervision terms, numerous and burdensome requirements, multiple systems requiring and having expectations of them, constant surveillance, including EM. This results in frequent so-called failures for women, minor infractions, curfew violations, not showing up to assessments and treatments that masquerades as noncompliance, but really survival behaviors are replacing those compliance behaviors that are expected of them. And places women at very unique risk for charges and technical violations, which is another key project we're working on as a committee. We know that women are, in terms of reentry, multiple systems navigation. They're trying to comply, as we mentioned, doing this with extraordinary grit and resilience. And I really want to emphasize that. The reality is that women should not be placed in a constant position of having to show grit and resilience and to constantly overcome systemic and other barriers. So what we'll hear today is incredible information on how we can get ahead of that and capitalize on women's strengths and capacities before they're placed in a position where they have to overcome barriers. And so the good news is, we, in the wake of evidence-based practices, which we know originally that research base was anchored in research that largely focused on men. There's a very powerful, robust, growing everyday evidence base on effective interventions for women, and a number of innovative models that are changing the landscape, including what we'll talk about today. Center-based models are part of this development, and they're taking us really out of this focus on individual risk factors and into a focus on women, on the various contextual factors that impact their lives every single day. It's transformative center-based models, as you all will hear today. And the last thing I'll share is that the Women's Justice Pathway models is also part of this new landscape of innovation. Many of you are familiar with this model and have reached out to us, which has been so exciting to have conversations across the country about the ways that this model is being leveraged to not only build on incredible research. We stand on the shoulders of incredible women who pioneered so much work and advocacy. It builds on that, and it reframes and grows the research and practice on women in justice. So very quickly, I'll just describe it. The WJP, as we call it, identifies 5 fundamental rights and needs for women. It's an integrated circle, as you can see, and it prompts criminal justice and other system stakeholders to expand narratives about women's risks into narratives about women's rights and needs. And so Deanne will speak more to this as this model underpins the work that we're doing across the country, and definitely the work that's taking place at the Reclamation Center. And you can learn more about this model. We have links that we can provide attendees. So let's get to it, right? Let's dig into the promise and impact of center-based models. Before I turn it over to our first group of presenters, we know that there are so many ways to structure center-based models. Each has its own vision and mission and constellation of services and supports. Some of the most important features, if we could say every model ideally would have these features, we wanted to share those with you today, and then you'll get to hear how they're being brought to life in these 2 incredible organizations and collaborations you'll hear about. So holistic. We don't want to reduce women's needs to individual risks that need to be addressed, but holistic supports and resources. Peer-led, we know the research on peer-led interventions is incredible. Family-centered, no place that women go should not be a place that's safe and nurturing for their children and people that they care about. And community partnerships that you'll hear about are the absolute lifeblood of center-based models for women, as well as leadership, advocacy, and skill development for women who are navigating systems right now. And of course, being gender responsive and attending to those risk, strengths, needs of women holistically. So I would love to right now, I will stop screen share. The first model we will hear about is the Reclamation Center from the Women's Justice Institute. Deanne Banos, Elizabeth Cruz, and Colette Payne will lead us in that conversation. So I will stop share, Deanne, so that you can get going to share your PowerPoints.
Thank you, everyone. I am coming on right now to share the presentation. I think I did it, please, and I'm going to put the, how's that, Josh? Are we good?
You are looking great. Thank you.
Excellent. Thank you, everyone. I don't know about you. I am not the most tech savvy genius in the bunch here, so I'm really excited. First win of the day. So yeah, I'm Deanne Benos. I'm the co-founder and director of Women's Justice Institute. We are delighted to be here today to talk about the Reclamation Center model. Something important to share when we talk about the Women's Justice Institute that's really critical to how we've crafted our model and how we do all of our work is that the majority of our colleagues are formerly incarcerated and currently incarcerated experts. And so when we work together, we call ourselves a think and do tank, where we test innovation and we do deep community work and national technical assistance and design work for programs and policies and solutions. These are photos of some of our team members. Two of our leading team members, Colette and Liz, are joining in this presentation today to present their work at the Reclamation Center. So I wanted to mention that. The WJI in all of our work is aligned with the model. Our three goals are to end women's mass incarceration, to reduce harm caused by the lack of gender responsive policies and practices, and other programs and interventions that harm both women, children, their families, and communities, and to improve health, well-beings, and outcomes among them. So we have three focuses for our work. As Alyssa mentioned, the WJI produced the Women's Justice Pathways Model. We know we've done several presentations and are working with several states across the country on this now, but this is critical because what we do is we leverage this model to design our programs, and it's been essential as the foundation of our Reclamation Center. As Alyssa mentioned, we have a paradigm shift from what focusing on women's risks and a deficit-oriented narrative of women that are powerful and resilient, and as Alyssa said, they shouldn't have to be, but they are, and brilliant women that are affected by systems. We shift from risks to rights. So we shift what justice, the narrative of justice, to justice is health and well-being. Justice is safe and stable housing, economic security, empowerment, supported families, and relationship safety. And all of these are interrelated in the program development of the center. Okay. And so when we talk about each of these pathways, we talk about each of these rights as a pathway. There's a pathway to justice, which is addressing these needs in a dignified way. And there's a pathway to prison, which is disruptions in a woman's life that are criminalized as opposed to supported. So when we think about the model, what we're really doing is we're applying the WJP to program development. And it was essential to the creation of the Reclamation Center. And as you can see here, each of these pathways were informed and programs are informed by women, the expertise and the innovation of women with lived experience on both sides of the prison wall. Key design considerations, just, Alyssa presented the high level of different ones folks look at across the country. But when we created the center, of course, the first and foremost with us is we centered on lived experience and expertise. Secondly, we focus on gender responsive practices and principles. For us, holistic, trauma-informed, family-centered, culture responsive are critical. We focus on rights versus risk, as we described. And we really focus on using centers. So many things are siloed in our systems and deficit oriented. We are focused on growing a system capacity to support dignity, well-being, and outcomes, right? And that's critical. When we talk about data-driven program design, it's important to consider what kind of data from who and where. And we really look at participatory research. Cross-systems collaboration is critical. You can see you have human services leaders here and correctional professionals and people from many fields because it's a holistic set of solutions. And for us, the baseline of the center is a pathway to reclamation, one that's beyond systems, one that doesn't keep women trapped in needing systems. It's growing capacity beyond systems and a narrative of that. When we talk about the Reclamation Center, there's some key components that my colleagues and I will talk about of our program today. So as you can see at the bottom of the slide, the baseline is the WJP for our work, right? We have 4 key areas of our services at the center, right, that drive a process of reclamation that disrupts systems involvement, recidivism, things like for our parole and probation colleagues, technical violations, reincarceration, and really shifts to a focus on health, well-being, and outcomes. And the 4 areas that we're going to talk about today in our programs are mutual support. That's peer-led mutual support. Again, 85% of our team are formerly incarcerated leaders and run and lead the programming at the center. The series of programs there like circles and basic needs support. We're going to talk about care coordination, participatory defense. We focus on decarceration and reducing violations and reducing incarceration in the first place. Children and families, with over 80% of women that are mothers that are systems. We focus on lots of family-friendly spaces of connection. Arts and advocacy as a healing-centered approach has been a critical component, everything from the design of the center throughout our programs on both sides of the wall, and community building and cross-sector partnerships. One of our missions is to really build capacity of the field, and we do so with our probation, parole, and colleagues across systems to do so. So we're going to talk first about mutual support. And I'd like to I'd like to cue my colleague Colette, the WGI Reclamation Center, Reclamation Project Director and Director of the Center, to share more about what happens at the Reclamation Center in our mutual support programming.
Yes, thank you, Deanne. And again, thank you all for joining us. Again, I'm Colette Payne, the Director of the Reclamation Center here in Chicago, Illinois. So just covering, some key points. Deanne spoke about the peer-led support that is so critical. Women need safe, culturally responsive, trauma-informed spaces where they can share their truths among peers, heal and reclaim their own narratives. And it looks different for each individual who's attending our circles, but they come to get the support they need in a safe environment. This process is the foundation of preventing recidivism and even ensuring success finishing parole, and most importantly, moving the individual, beyond the system. We host monthly reclamation circles here at our center, and we also host them inside IDOC facilities. We are planning to start hosting circles in Cook County Jail as well. In doing so, we will be able to engage women early in their release planning process and connect them to the center for reentry. The way we operate is also critical. Excuse me. We acknowledge all the unique competing issues that pull women away from investing in themselves, their health, well-being, safety, and success. That's why we created this welcoming, warm environment where children and families can come, where they can be around those that understand their challenges without shame is so important. So you see the pictures here. I don't know which side, they're to my left on my screen, but Tamisha, her children here, beautiful family. I remember meeting Tamisha while her children were really small. So I watched them grow up on the reunification ride, and we built that relationship while she was behind the wall. She came home, jumped right in, getting connected, and started identifying, even before she left, what her needs were. So the first thing, she was like, hey, I need a place for my children. We were able to get her secured in an apartment where they paid the rent for a year. We were able to get her in a high school program where she got her high school diploma. She's now working. Like, Tamisha is doing wonderful and stays connected with us all the time. But it's like, and it doesn't mean that they just move on for the program from the center. They're welcome to come back anytime they feel they need support, because as I know, once you get your life on the right track, doesn't mean that another area, like we talked about in the WJP model, falls off.
Thank you, Colette.
Yes, absolutely.
And another aspect of mutual support is really addressing basic needs and issues of dignity. And I would love for Liz Cruz, the Senior Advisor for Health and Wellbeing and the Lead Care Coordinator for our Cook County Health Women's Reentry Initiative, which is an initiative targeting 250 women with a SAMHSA-funded grant over a 5-year period to support their diversion and reentry from jails and prisons throughout the state, to speak to some of our survival initiative work.
Thanks, Deanne. I appreciate that lovely intro. Honored to be here today. I just love doing this work and using my lived experience to support and collaborate with our cross-sector partners and women I'm able to serve. Much of what we do is really entrenched in dignity and basic needs, and in those areas. We do not want women to just get out of prison and jail and just go find a job or just recover from addiction. It's really not that simple. Even though I feel like folks think it could be that simple, it really isn't. Many women have had their dignity stripped away from them long before they even were incarcerated, and they carry the stigma. And it's only worse when they are struggling to keep up with parole requirements, treatment schedules, finding housing, securing employment, reunification with children, and sometimes they can't even afford their basic needs. like soap or hygiene or professional clothing. They can't even afford a bus ride to come to appointments. Or when they do stabilize, they experience a setback, like a bill doesn't get paid, and they don't have any heat, and they just got their children back. And that's where our survival backpacks and survival funds come in. Survival backpacks are designed to support women with basic needs, such as hygiene items, women's reproductive needs, and an array of underclothes, winter items, and many more. These are imperative for women to have access to, as these are their rights and their needs. And we are helping to meet those needs of women. Women feel as though they can ask for what they need with dignity. The survival fund is imperative for women to access when crisis arises. There are so many collateral consequences from incarceration that women often experience crisis as soon as they're released. The survival fund is designed for women to have access to cash assistance for various needs that may arise. Women have been supported in various ways, such as paying an old light bill to have lights on in their new home, or being placed in a hotel because they're at risk of homelessness, or they're running from gender-based violence. And this all addresses the 5 rights and needs. This support will allow them to move away from the system and provide a safety net for ongoing stability.
Thank you, Liz. I think you're going to be up one more time. I cued Liz's work as the lead care coordinator for our initiative with Cook County Health. Liz, can you speak to this program and share with us your wonderful work here and that of our team?
Yeah, thank you. This program is really essential at the Reclamation Center. It not only engages a team of entirely formerly incarcerated peer care coordinators, but cross-sector partnerships. I am so very grateful to lead this project, to work with women and partners that include Cook County Health, one of the largest public health systems in the nation, along with Cook County Jail, one of the largest in the nation, Illinois Department of Corrections, and IDOC Parole, in addition to some of the largest treatment providers in the state. By women reclaiming their lives, this allows women's parole and reentry to be successful. Our model is collaboration, and we are building a community of partnerships. By working directly with Parole, I am able to collaborate with the team at IDOC and start to develop a plan for the women prior to release. I am able to engage and connect with them and learn what it is that they need so we can have things established when they get out. I can connect with the parole agent prior to release so that women feel like they have a community of support, and then we're working together as a team. By having lived experience, I often think about how much I wish I had someone to advocate for me and support me the way I'm able to do that for other women. The care coordinators all receive gender-responsive, trauma-informed training, but also really follow and prioritize the Women's Justice Pathways model to ensure that the participants' rights and needs are addressed with dignity and support. Many times, women feel as though they get transactional services, and here we support women in a way that feels genuine and where they can come to the center where they feel safe and at home, and to access ongoing support. Now courts are even approving women to get out faster because they know that they're going to have the support of the Reclamation Center.
Great. Thank you, Liz. Now we're going to run to time on this a bit. When we talk about mutual support also, and I'm going to discuss this briefly, mutual support also involves women supporting other women to disrupt their trajectories, secure early release, and really address technical violations, address women behind the wall that are trying to come home to their families and children. Gender-based violence is a huge part of this. We have a campaign and training that we do on these issues. And these are just 2 recent women. Janet Jackson on the right, who is absolutely wonderful. She's written laws while behind bars for over 30 years. And finally, due to legislation that was passed as a result of the Reclamation Center work with women, was able to be freed just last week. So I just want to celebrate that a moment. And Crystal Martinez on the left, who Colette participated in these hearings, also recently learned that she can come home after a tremendous campaign for her release, which has been really exciting work.
Yes, it has its rewards. So Janet, she was released after 38 years due to gender-based violence, and Crystal, she'll be released. She served a little over 2 years. But, in doing this work, before I started working with the Women's Justice Institute, I worked for Cabrini Green Legal Aid, CGLA, for 7.5 years. And like kind of got my start there. And policy to me was very important because policy, participatory defense, whatever you want to call it, I think that, policy plays an important role as well. And if women don't have the legal representation that they need and not being able to afford it, they're just stuck in a system with no help. So
Thank you, Colette.
attending these hearings for me was important. Watching their struggles, attending for Janet, per se, she had several hearings where they turned her down for parole because we're just not believed when we say that we were harmed. And during Janet's time of incarceration, again, she was incarcerated for 38 years. Marital rape wasn't even a thing. So she couldn't present that during her sentencing.
Yeah,
So
Colette.
having a community of support attending these hearings most definitely makes a difference. And I'm just proud we have a Reclamations Fellow Project where I take women, train them up, cultivate them on their skills around policy and advocacy so they know how to advocate for themselves and others.
Thank you, Colette.
Mhm.
And I know we're running to time a little bit, so I'm going to move a little more quickly through a couple of the other slides here. But a critical component for our group, as you mentioned, another prong is children and families, because 80% of women, as we know, are mothers. And staying connected through the center, having a safe place for children and families to have a hub for connection on both sides of the wall, and operating the reunification ride bus that Colette will speak to. We're going to jump to the advocacy next, Colette, but a brief discussion of what that is and how families stay connected to the center and a critical component.
Yes, absolutely. Our center is most definitely a hub for all, and all are welcome. But 80% of incarcerated women are mothers. I know from my first-hand experience, having several incarcerations, my children having to have family step in and help me raise my children. And without this support of reunification, right, where we take the caregivers and the children to see their incarcerated moms is really important. The reunification is about more than a simple visit. For me, it's about building community and building support. And a lot of these caregivers find their voice and want to, in fact, help us push certain legislation as it relates to gender-based violence. So with the Reclamation Center, as the new home for the reunification ride, we are building community with and for impacted women and their children, and providing them with safe, family-friendly spaces to connect upon reentry.
Thanks, Colette. And then briefly, I'm going to slide through a couple of these. An important part of the center is that we see women in prison as, like we say, community in prison. And really, women that are in prison are part of our community that we're building. And the powerful arts and work and programming and the development that experts behind the wall are doing are critical. So we consider the prisons and jails in our state part of the Reclamation Center. We host annual arts events. This is our annual Look at Me for DV Awareness Month. But the beauty of it is that we hybrid our events. So the women that are behind the wall that are members of the center are featured and their voices are heard. And that's part of our arts and advocacy approach. We've recently obtained a gallery where arts have always been a part of our work, but it will be exhibited with workshops that are, again, part of a healing process. And we love that our parole partners love the arts aspect, and agents always want to come and see the art and really think it's a transformative experience to create those collaborations. I'm going to zip because we're a little bit on time, but Colette did mention the fact that part of the healing process for women is changing laws and legislation. And just very briefly, you guys, we can come back to this later, Colette and Liz, since you did mention this, Colette, but yes. Serena on the right experienced abuse her whole life. And she was able, through her reclamation planning process, to say she wanted to help others. And she did. She testified before our legislature. A law passed to carve a pathway out of prison, and she was honored by her peers. And then the last part of our presentation that's kind of a root is community building and cross-sector partnerships. This picture was taken when APPA joined our national launch at the center for their Chicago conference last year. We were delighted. The Tribune put it on the front page. And really, we've created a space where community events and partnerships and safe spaces for all of our systems partners is key, right? Trainings, workshops, events, community building that people can all be part of. I purposely put Veronica in the middle, our APPA executive director, because she's there on our roof with our colleague who's the former director of reentry from the city of Chicago. But it's always an open space for people. And lastly, our center is a national training center. So agencies and departments and organizations can come and do retreats with us for a day or two on gender responsive practices, develop a policy or program or learn about something, bring their teams out. It's very amenable to that work, and we've done some exciting work with our colleagues. And I purposely put Leticia and Tira here because they're going to on there because they were at the national event. So thank you so much. We See Women. This is the symbol of the Reclamation Project. And for more information, we'll put it in the chat about ways that you want to learn more about this. Is our email, contact@womensjusticeinstitute.org. Thank you so much.
Thank you so much. And you can stop your share, Deanne. And so thank you so much for that. Again, questions and some dialogue we will offer at the end, optional for folks. And I will immediately turn it over to an incredible group of folks. Leticia, I will let you kick it off to talk about the Collaborative, another incredible national center-based model.
So it's a pleasure to be here with all of you today. And I can see Leticia has the slideshow up that we are going to share with all of you. And Leticia, why don't we just jump real quickly, since we've all introduced ourselves, we can just jump right to our second slide. And we now call ourselves the Collaborative, but we began by calling ourselves the Magical Unicorn, only because we came together and recognized, I'm with the Oregon Department of Human Services, and we had corrections. We are located in Southern Oregon, so Jackson County is this wonderful community in Southern Oregon. And we came together with the Pathfinder, and all of us recognizing we all had a unique niche, and we had a lot of opportunity for improvement, how we connected together to support women who were correction system involved. And as we were talking about it, we were trying to figure out how to do it and realizing there wasn't a roadmap. We were going to blaze our own trail and figuring out a way to come together. And so we had the opportunity. COVID presented some unique windows of time to think differently about how we use spaces and places together. And together we came together and started what we now call the Collaborative. So Leticia, if you want to go to the third slide, that would be great. We took a building that was an Oregon Department of Human Services building that was once full of people and seemed as if overnight it emptied. And we thought we could do something different together and create a space and a place and a different way to serve women. Leticia, I believe you're on mute.
See, teamwork already in action. Let's see here. All right, are we good? Can we see your screen and you can hear me? Okay, thank you everybody for your patience. So we came together as a team and really had conversations about what we wanted to create and what the values of the work that we would do together would be, and how we would collaborate and how people would feel coming into the space and in relationship with us. So the mission that we came up with is really to cultivate a space for transformation and collaboration in service of women and gender diverse individuals so that families could be safe and thrive in our community. We wanted to create pathways to holistic, integrated, and responsive services and supports for women and gender diverse individuals. We wanted to model transparency, honesty, teamwork, self-efficacy, diversity, equity, and inclusion, impact, growth and learning, integrity, creativity, and innovation. And we wanted to have some commitments as a team that we prioritize self-care and empathy for ourselves, for our community, for our participants that would visit us, service, respect, open-mindedness, safety, trust, and communication. And all of those things have definitely guided us along the way. We did create this statement to participants, and I'll just invite you to read it. I won't read the whole thing to you, but I just want to lift up some of the things that were really important to us as partners. And when we held listening sessions and focus groups for women that would potentially be visiting the collaborative, there were some really key themes that they said would be important to creating a space where women and gender diverse individuals would want to come. So we wanted to provide a safe space. We wanted folks to feel welcome and heard, to be met with respect, to be supported in seeking their own solutions, looking at a variety of different resources and supports, have their needs met in a user-friendly way, honor their humanity, value perspective and voice, safety, value your contribution to yourself, your family, your circles, our shared community, value the urgency you may have in getting your needs met. We value humor, being lighthearted, enjoyed our shared life experience. We value your trust and intend to earn it. We value and honor you. We want to work mindfully with one another, sharing a collective growth mindset, and how we partner with each other and in how we engage with participants, how we co-create this useful and transparent shared safe space, provide holistic support, honoring readiness on their own terms of necessity and safety. We want to be useful and effective, collaborative and resourceful, trauma responsive, empathetic, present, and attend to earn trust and not presume our titles feel inherently trustworthy to you. And just to say that we're so glad that you're here. So one of the things that we heard over and over was just the first thing you experience when you walk into a space, what should it look like? And we heard it should feel like a living room. It should feel like you could pull up a chair or sit down on a couch, have a conversation, have a cup of coffee, grab things that you might need from the shelf, whether it was a Kleenex or hygiene products or a book or a magazine to read. So we designed this space that met the needs of all of the organizations that were involved in the collaborative, but also felt welcoming for our participants as well. And I'm going to pass it to Tiffany.
Thank you, Leticia. So for the collaborative, some of the goals that we set were to remove barriers, increase access to holistic and integrated care and services, as well as the likelihood of individuals completing their justice system and or DHS system involvement, stabilizing not only them, but their families as well, providing service to the whole unit. And then some of the efforts that we focused on are mitigating the impacts of trauma, decreasing social isolation for impacted community partners, preventing misuse of substances, employing community-wide approaches to reducing harm associated with behavioral health issues, and ensuring access and coordination of services. We'll get to talk about peers. I love peers. So here's some pictures of our space, the peer space at the collaborative, and then some of the folks from our team. When we were doing the talking and planning of how, these three agencies would all collaborate and partner, peers, I like to think, are really at the center of that. We have agencies and we have systems who do great work in the community. And also as peers, we have very unique roles. So we are able to partner with both of these agencies to do some of the things that they maybe can't do. We're able to develop different types of relationships with the participants that we are serving. We're able to get a real idea, and through our lived experience in navigating systems and just all the different barriers that come along with, maybe well before we were ever involved in systems, being able to walk alongside people to say, hey, I'm not just going to say I'm here to support you. I'm going to walk alongside and meet you wherever it is that you need to be met. All of the folks employed on our team have lived experience in navigating systems, and they truly demonstrate a heart for doing this work. Our partners have been so supportive. I think one thing that's really important too is when, considering center-based models and folks that will be put into shared spaces together, to give people a choice of where they want to be, right? You can take people and plop them wherever it is, but if there's not the passion and the commitment behind that, then I think things can go very, very differently than what we've experienced at the collaborative. So I would just say it's been an absolute gift to have our peers be supported and valued so that we are able to meet with women and their children and their families to really support them as a unit, instead of just focusing on different conditions or just one thing. We're able to really wrap around and support the person as a whole, which has just been amazing. Also at the collaborative, we all offer cognitive behavioral classes, which is really, I think, a fancy way to say that we get to hold space for people and teach skills on how to move through life. There's so many times that folks are looked at according to the things that they've done or the things that they are doing. And it's like, who's really teaching them skills? That's where peers get to come in this space, and we get to teach them real tangible skills according to their life experiences and how to move through whatever it is that they're going through right now, but also in the future, so that they can be successful long-term, not just in order to complete supervision or DHS, but really giving skills that they can use in the moment, whatever it is that they face. So there's our classroom and some of our worksheets. Kiddos. So one of the things I think Deanne mentioned, that 80% of women do have children. In my experience, when I had to go to wherever it was that I had to go, my children were coming along with me. And what we've done at the collaborative is really set up a space dedicated to children, where moms or parents are not having to worry about kids touching, printers and all that stuff. They can be in the space to receive the services and the supports that they need, and their kiddos can too. So we have different activities for different age groups. We have individual sessions in this classroom. Sometimes we have a peer go sit in the classroom while the mom is meeting with someone. Everybody occupies this space. So we're able to really center, the participant, again, their whole family needs. And I will kick it over to Kim.
Yeah, just real simply, what we've been able to do by being in the same space together is the women that come to us can get their needs met all in one place. And we have the ability to work around food insecurity, eligibility for medical plans. We're able to do domestic violence intakes. If individuals are coming in and we're learning about new experiences with domestic violence, we can engage right in that moment without them having to go elsewhere, but we can bring those resources to them in a safe place where they have their peers, their PO, whoever may be that individual or individuals with them that needs to be centered on. It includes employment options. And while we're all co-located in this building, we also bring with us our social network of all the other provider agencies we're all connected with, whether it's mental health, whether it's substance use, whether it's our church community, our faith-based communities. There's so many other entities that are a part of this social fabric that we've created that for the woman coming to us, she only has to go one place and we can bring what she needs to that same place, or she can identify that place for her that brings her the most sense of safety and support. And we can mobilize collectively together to meet her where she's at.
So within the collaborative, we have parole and probation officers embedded there, and all of the high and medium risk women that we supervise actually report to the collaborative. We have 3 parole and probation officers who supervise diverse caseloads, from women who are convicted of domestic violence, women who are releasing from prison, women who are participating in our family sentencing alternative pilot program, which is like wraparound care with women and DHS and their children, and really just women who are just convicted of a property, drug, any type of crimes. Our POs really use a relational and gender responsive approach. We use strength-based approaches, and we understand that women entering the criminal justice system enter in a different way. They come in through a different pathway other than men, and our POs are really responsive to that. We use a gender specific risk tool to evaluate women, get to know women, see what their risk and needs are, and really target what they need. And base our case plans, which we do goal setting with them. We do cognitive skill building. We kind of partner with Pathfinder Network on the same skills they're using, and really build upon what women need to be successful on supervision and leave supervision better than how they came on. That's really the ultimate goal. We use pathways to change, cognitive behavioral tools, and our POs are in a shared work environment. That's what it looks like right there. And it's really allowed our POs to be relational and allowed the women to get to know all of the POs, because if their PO is not available, they know who this other person is, and they can see that person and meet with that PO and feel like they have a connection to everybody in that space. And yeah, so if you want to go to the next. We also have one-on-one spaces in the collaborative. So these spaces are available for our Pathfinders, DHS, our POs to meet with women in a private setting to complete those risk assessments that I talked about, have more private conversations, just allow safe space to be able to talk. And they're really comfortable environments. So. And we also have this lovely gated outdoor porch area that if a woman, if they don't feel comfortable, if they have a kiddo that's running around, we have this lovely outdoor space that we can use and utilize. And I mean, it's a little cold right now in Oregon, so it's not used as much, but we definitely use it in the spring, summer, and fall. And it's a safe space that's enclosed, which I think is huge. And there's no access to the general public, which is amazing. So.
Okay. One of the other things that we get to do, which is one of my personal favorites, is mobile support and events. So a lot of the times we have services that are restricted to places or specific locations. And so in order to meet folks exactly where they're at, we have mobile peer support where we are able to pick up items and take them to participants. We're able to take participants to appointments or grocery shopping or wherever it is that they need to go. We have peers available to help get those basic needs met. And then events, we host quarterly events. We actually have one coming up soon. Those events are all centered around engaging community and learning different activities and just being a part of a place where you can come and be exactly who you are, building relationships. So these pictures right here from our women's empowerment brunch, actually 2 different events, which we have created to be an annual event now. These are open to all of our participants, and the feedback that we receive is really positive feedback. The women love being able to come and be in community together. A lot of the times there's barriers to creating relationships with other women for women when they come due to past experiences that they've had. So being able to witness these women building relationships with others and carrying those relationships on, utilizing each other. So another form of peer support to be, just happy and live self-directed, healthy lives.
So at the collaborative, we have seen a lot of success. We have had, I mean, you can see the stats right there about how many people we've seen in the first year. And honestly, the numbers have steadily increased over each month. We are busy, like we are busting at the seams sometimes. And it's really amazing. We have women coming in who, have tended to abscond supervision for years and years and years. And they come in and they're reporting regularly, and they are feeling welcomed and safe and building connections with not only their probation officer, but they're building connections with a peer, with DHS, and all these, peers aren't scary, but DHS and parole and probation can be really scary agencies for women. And we have created such a safe space that women want to come see their PO and want to meet with DHS. And thank goodness for the peers, because they sure help us with that. And overall, we've seen tremendous success, and the numbers speak for themselves, but really it's the anecdotes of having the women come in and say they feel safe, and seeing women who tend to not show up and be present and engage. So.
Okay, so Leticia, were you going to say anything else to close that out? Okay. So thank you so much to the collaborative team. I've had the honor and pleasure of visiting the space and interacting with these incredible people and their teams. And I just can't help but think that 20 plus years ago, when I started in this work, the idea of an incredibly safe space for women where parole and probation officers and human services and other providers, faith communities would be present for women in that space or go with them to a preferred space is just mind-blowing. It's absolutely mind-blowing. So I just want to thank all the presenters. Clearly, and we hope that we've demonstrated strongly, I'm just so moved by, Lindsay, what you presented around this, that we really want to get concrete, fewer technical violations, showing up, completing supervision, wanting to meet with agents, service providers, versus feeling scared and being locked into survival behaviors because there's no support. So clearly these models are having a concrete impact on traditional indicators, things like recidivism and technical violations. But what's really inspiring is that we're seeing new ways of defining success. The models are redefining the landscape of justice for and with women, for sure. They're redefining the relationships between traditional and new system actors, which I think is incredible, and bringing justice, support, solidarity to women, children, and their families into community where it belongs. That is where it belongs. So we are just so excited to wrap up today. As I mentioned earlier, we'll stay on for another 10 minutes or so for some Q&A. But as revisiting some logistics, we've gotten lots of inquiries during this presentation. You will absolutely receive some information representing what we talked about today. We'll be responding to your questions and emails, and we, of course, want to invite you to be present at the APPA conference. Come to our committee meetings where we'll continue to nurture these ideas and offer support for folks who have models or want to launch their own models, and dig deeper into, gosh, how do we start the relationships that are required for this cross-sector work with women? So we're happy to carve out additional time for that. You just let us know, and we will show up virtually or at conferences to facilitate and support that. And of course, we have opportunities through our committee work to meet virtually because not everyone can make it to conferences. So we want to reassure folks, if you're not coming to the Winter Institute, we have 3 to 4 virtual engagements a year so that folks can join and be not only aware of our work, but inform the work on that platform as well. So I will officially now invite folks who are interested in staying on to ask any questions, make any comments, and Deanne, I know that you will help moderate this optional Q&A portion of the webinar.
And I did note, so for everyone, so we're going to add 10, Alyssa,
Yep.
APA colleagues. Okay. So far, I've seen 2 questions. The first was from Latoya W. How does gender-based programming change the dynamics for women on supervision in either probation or parole? And I'm wondering if Leticia, maybe as a former parole, you formerly work with parole, right? So maybe you can field the first one. I'd love to add after if any of our colleagues do, but maybe Leticia, I'd love to bump it to you.
Absolutely, yeah. And Lindsay, I know you lifted up some components that I'll try to reflect, but I think, centering around women's rights and needs is one of the ways that it changes the dynamics. It really shifts away from compliance and conditions. And I love what you all said earlier, the checklist of things that women need, the additional, yet another checklist of things that women need to do, and center for a moment in a safe space around what's really happening for her, how she's experiencing it, what she needs, what are the barriers that seem most important to her. So it's like having that conversation, centering on what's important to her, what we know will make an impact with her success on supervision or with other systems as well, and really engaging her through her strengths that we can leverage and her resilience that we can leverage, to be as self-directed as possible. And I've seen that so powerfully at the collaborative and also at the Reclamation Center with agents that have been there, and I've seen the interactions, and they just look so different, empowering. And I think setting women and gender diverse individuals up for life beyond supervision. We definitely want them to complete supervision and be successful. And what's next for her and her children and her families is critically important too. So thank you, Deanne, for letting me share. Those are my thoughts.
And just one little add, because I want to get through both and then we can all kind of jump in at the end. Something else I think is important to spin off of something you said, Leticia, is, these are practices. So what I've noticed over the years is that people learn gender responsive, and they look at the words and the checklist. And you were talking about the checklist for the women, but when people say gender responsive, they think we passed a law in Illinois where and that has been modeled in 2 other states, right? Where everyone wanted to do this law and talk about gender responsive and mandate it by law. But what it ends up happening is saying, oh, the department needs to be gender responsive and trauma informed. And it becomes a talking point, but people don't invest the time in training to learn what that actually means in practice. And so models have evolved. Like I've seen other models that have failed. I mean, to be honest, I'm not saying, but because, we're just going to do a model and we're going to be trauma informed. But what does that mean? And if you're not investing in the implementation of it at a deep level, that's a critical part. It's not just coming and taking 3 points off a webinar. It's much more than that. And that kind of leads to the next question, which is the only other one from Margarita P. What specific challenges do center-based models face in effectively addressing diverse needs of justice-involved women, and how can these models be further refined to maximize their impact? And I'll say refinement, sort of like refinement. I understand kind of what the barriers to success, I think, is people doing them, thinking, still having that mindset of a talking point of what you're doing, and not thinking about the doing part. And I would love to tee that up to anyone in the group to respond to this question. And that's my 2 cents. But does anyone want to?
And I was going to also say that another a question popped up too that I want to make sure we get to. It says, can an equivalent approach and array of programs be targeted for men and their needs? I love this question. And I just want to say, yes, I think what we're finding is that there was this huge gap in information mainstream, like where in journal articles and mainstream areas of research in criminal justice. I mean, women have known for centuries what they need. And so finally being elevated in kind of dominant discourses, which is great, giving us permission to actually rethink services and supports for men in all gender groups. And I have been so enlivened by that personally and professionally to see how when we, for example, talk about trauma and resilience and the essential recovery and other supports that women need and deserve and girls, it gives us permission to say, are we missing this among boys, men, and other gender groups? Are we looking at intersectional identities and unique experiences of trauma, health, healing, recovery? So we really, a lot of the training that I'm doing through CORE has grown incredibly because of the demand for supports for all gender groups and to remove some of the stereotypes and ways we box boys and men in around what they need and deserve. So yes, these principles can be applied. And I love that the collaborative mentioned, focus groups, inquiries. Before we built this collaborative, we wanted, who was our service target? Like, who did we want to be of service to? Let's hear from them first. So those of you who are looking to do this with girls, boys and men, other gender groups, to make sure that you take that approach, hear from them, invite them as leaders, architects, and that will lead you exactly to where you need to be, because in an ideal world, we'd have center-based models for all human beings who are touching justice systems. So I love that question. And then I'll throw to the group, to my co-presenters here, where do you attend gender-based training for parole and probation officers? So what training is available? Does anyone want to speak to that?
Well, I was actually going to offer a chat. I think that, there's several options, as we know, out there. We know that NIC offers training that's free to departments. And there's several organizations, like I mentioned, like we do a national training academy, like in person and retreat, like hybrid or in person or retreats at our center. I know Alyssa does trainings. I know Leticia's. There's a number of people that do trainings across the country. And so we're glad to, and I know APPA has resources as well. So Omar, we're glad to chat if you want to reach out or contact APPA for some folks they work with as well. But really glad that you asked that question. It means you're thinking about taking some action, which is great. And I think there's a lot of good options for you there.
Yeah, we'll send some of that info as a follow-up to this webinar, which we're really excited to provide resources. And then hear from you, email us anytime with additional questions that you might have or supports. One of the things we do as a committee is we want to mine the field for the things that you think should be elevated nationally and be a conduit to share that, not only with our committee, but APPA and the national work really needs to elevate what you all are doing that's deeply innovative and shaping the field that maybe hasn't had a chance to be seen yet. So we really want to help facilitate that. So do stay in touch on, we're working right now with a state that joined our committee recently. And the thought is that we need to feature them at the next webinar because they're doing just some incredible court-based work that's anchored to women's strengths and needs. So stay tuned for that. Any other final thoughts? We're just coming at the end of our Q&A from presenters.
Alyssa, there was one additional question in the chat. I can, and then anyone who wants to jump in can jump in. It's an incredible question. It is, what is currently being done to evaluate center-based models? What would you recommend to center models when evaluating their programs? Excellent question.
And that's an interesting. Does anyone else want to jump? Because, and I'm glad to jump a little bit to take a little bit of this. I think it's a longer answer, but does someone have a very crisp thing that they wanted to?
Chris.
Well, I was going to say this. This is what's interesting about it, because we've talked about this as well. We have several academic partners at the Institute, right? We've worked with University of Illinois, Chicago. We've worked with Loyola. We've worked with University of Chicago. We've worked with Northwestern on just different programs and things that we do, right? And when you think about a center, that part of what Alyssa described earlier that we like to say a lot is like, how do you define success and what does that mean, right? And so when I think about it, I think about maybe like we have our Cook County Health Model, and that's a specific program tied to the center where resources are leveraged for an evaluator that's funded by a SAMHSA grant, right? But when you think about a center, it's an open space for people to come and go throughout their lives and not feel like a number and not feel like you always have to you always have to balance the transactional work and, you know, what we all know is a bureaucratic set of systems and standards that you're pushing against what success is versus what programs you're evaluating, right? So we like to capture how many people are coming through, how many people returned, right? And even then, to me, if a woman comes and she's in crisis and she just needed someone to lean on and then she wanted to move on beyond systems and she received an employment opportunity or housing and she didn't want to do programming, that's a success versus another woman comes back 20 times because she's earlier in her trajectory. So as any evaluator knows, it's really about your target group and how you define those metrics and what you're talking about without corrupting the intention of the model. And I'm speaking out of both sides of my mouth intentionally and fully self-aware. And I see lots of heads nodding, but like you have to think carefully before you start to put the grips on something, right? Like I can tell you our Cook County Health model, amazing. Recidivism down, outcomes amazing. We measure that. And we know the question is how much better is it that a woman has a place to go as part of a traditional federal grant for drug treatment, right? Because it's different when you add this, right? And how do you compare it to others would be a good research question. But like, I don't know if I would want it to go in a certain direction. I would love just to open that up for another dialogue another day, but
I just add to that, Deanne, that your evaluation needs to be as holistic and integrated as the services that your center provides.
Yeah, a lot of money.
The qualitative participatory action research as much as we value the quantitative and see the way that those two things can really powerfully come together and tell a story, but also lift up the voices and the input of the people that the centers were created to serve. So that's my tag on to your really great response.
I love that. And what I'll tag on and just emphasize heavily is what you both mentioned and we mentioned earlier. Participatory action research and evaluation protocols are essential. So much research to establish evidence did not include those who these supports were designed to serve. It's something that we are working on as a committee and definitely at an institute, and have allies and partners all around the country who are trying to, I love how you say it, Leticia, that we have to really make these research and evaluation processes as holistic as the programs and supports that we've designed. And those who are architecting should be those who have survived systems, who have designed the programs because they know what they and their children and families and communities need. We are on across sectors that we have a long way to go on that. And so we're looking as a committee to really engage again, like where can we support that work, have APPA be a place where we can generate and expand how we define success. And so I really love that. These were great. I mean, I couldn't think of better questions. Application to multiple gender groups. How do we evaluate these models? And we know that funders and legislation often is tied to key outcomes in order to receive more resources and support. So it's a both and. The good news is for both the collaborative and the reclamation center, the traditional outcomes are through the roof in terms of positive. And also we're expanding how we talk about success, as Deanne and Leticia said. So that feels like pushing the field to grow and instead of contract around how we defined what's working and what's not. So I think that brings it to any others, Tiffany, Kim, Liz, or Colette, anything, Lindsay, that you want to say before we log off? Well, thank you so much, everyone, for your time today. And we look forward to seeing you on email at institutes and in our virtual engagements. You're all officially on our list of communication. So thank you so much. Have a great rest of your Friday. And we will hopefully see and hear from you soon. And thanks again, APPA, Kylie, and Josh.
Thank you. Oh, look, it's the Faulkner effect. Commander Faulkner, thank you. A little shout out.
Thanks, Commander Faulkner.
I love it. Okay. Thank you, everyone.